good evening, good afternoon, good day, good morning, whenever you all are out there watching this. I just want to thank you for joining us on this edition of MS Views. And this is MS Patients Voices, and we're back with a few of the people that we spoke with in 2020 with regard to COVID, their families, the situation that they have going on. And we have two newcomers, all right? It is a couple, okay, husband and wife, that is, all right? And one is a caregiver, one is an MS patient. We're going to be speaking with both about what they did a year ago with COVID and up to current. So right now I'm going to begin with the young lady in the middle. All right, her name is Pam. Okay, I hope you don't mind my saying your name, and your name is Pam. All right, today your name is Pam anyway. All right, and I want you to first tell us when you were first diagnosed with MS. Give us an update on this, when you were diagnosed.
I was first diagnosed in 2010. I was working as a nurse at one of our local hospitals, and I was driving home and lost my vision and couldn't walk, and they thought I had a stroke at first, and then took me in for an MRI and found I had MS.
Okay, so since being diagnosed, though, what have you done that you felt was a great accomplishment in life?
I haven't given up.
That's great. Blake, glad to hear that. Lliki, can you tell us the same thing, please? First start with when you were diagnosed.
Okay, I was diagnosed in 2010 in the summer. And so, of course, because we live in Florida, I just thought I was really hot all the time and it was making me tired. But no, it turned out to be MS. And what have I done? I've stopped working and I've been following doctor's orders and enjoying life.
That's great, thank you. So that's good to hear. So Michele, so you have multiple sclerosis, yes?
Yes.
Okay, that's not just something you tell everybody, right? It's not really Howard, even though Howard's got the cane, right?
Exactly.
Okay, good. All right, so when were you diagnosed?
I was diagnosed in 2006.
Okay, and during or, in life since diagnosis, have you been doing anything that you felt was of, great accomplishment, even with being diagnosed?
Yes, I have. I completed a marathon about 6 years ago.
That's awesome.
And I wasn't the fastest. I was actually the last person, but it was
great.
awesome because
You
I
finished.
got a last person award and I finished. So I'm proud of myself for that.
That's great.
And I still work full time and try to stay as active as possible.
That's cool. Very good. Howard, so since your wife was diagnosed, what have you been able to do that you feel that was just a great accomplishment as well?
Me personally?
Yes.
Well, actually in that time, I took up running also, just to help my own health and health benefits, and that's where Michele got the idea. So I've completed 2 marathons, countless half marathons, and they're just things that I set myself to do and was able to get them done. But I'm glad. Actually, I ran my very first marathon for an MS charity out of DC.
Great. That's awesome, too. So, Michele, let me go with you now, all right? Over the past year, how have you been able to manage your family and yourself with everything that's been going on?
It's been really hard for us because we have a multi-general home. We bought a home 2 years ago and we decided to move in Howard's mom. We decided to move in his sister and her 4-year-old son. And then it's myself, obviously, and my 21-year-old daughter was at school. So when the pandemic happened, she came back from school to stay with us, and everyone that was working outside the house all of a sudden was all in the house. And we have a nice size, decent size home, but all of a sudden everybody was all together.
Sure.
So it was a little stressful.
Sure. It's like having a kibbutz, right?
Exactly. Too many personalities under the same roof.
Right. So Howard, how did you handle all this? How did you keep everybody going? And is there any fighting going on there?
Quite a bit, actually. It's multi-generational, so it's my mom, my sister, and my 4-year-old nephew. But I was working from home anyway.
Sure.
So we bought the house with the intention of me working from home, moving everybody in. Pre-pandemic, during the day, it was me, my mom downstairs in her room, and a bunch of animals running around the house. As this situation in the world started, everybody started moving back, and our daughter moved home because she was worried about getting locked out of the house if there was an outbreak at school or something, not being able to come home to see her mom. So it has been very difficult. It's been an adjustment for all of us. I have an office in the house. I'm very lucky. I can close my door, do what I need to do. But I get reminded frequently when she's on a conference call not to walk behind her because she's out in our open bonus room.
Sure.
That's where our little refrigerator is to grab water. So it's been an adjustment for everybody. But and and as she said, our house is a decent size, but the walls have closed in quite a bit. So it's been difficult. We've been managing it, but it's an adaptation for everybody.
Okay, thank you for that. So Pam, all right, tell us what you've done. What did you have to do with, like, say, you were involved with a support group? All right, how were you able to manage everything that's been going on?
Right now, our support group is still on hold because we don't have a place to have all these people together. I was doing a lot of volunteer work everywhere, but a lot of it now I do on Zoom-wise. I work with young kids with Asperger's and autism, and we do it doing Zoom. Yesterday was the first meeting from UCF. I'm on the UCF alumni board, and that's our first in-person meeting. So it's like some things are getting back to normal again. I still go for my infusions, and I just try to keep busy. I have a new puppy that keeps me busy.
Sure.
And just trying to get on.
Sure, that sounds great. So let me go back to one thing with Michele. Functionality in your home. Have you been able to manage everything?
We have. It's been stressful, like we said, but we haven't killed anyone yet, so we're
Okay,
good.
that's good to hear. Lliki, what's going on with your home, with your life, with everything you do? You travel all around the United States. I mean, tell us what you've been doing.
I did a lot during the pandemic, or it is somewhat still pandemic
Right.
time, but I did a lot last year. This year I haven't as much, but I will be going to New York next month to visit my son. And I have joined Rotary since we last were
Sure.
here, and I love it.
That's great.
Yeah, I'm very
What do you
involved.
do with them?
I've been very active with their fundraising, so it's really been a lot of fun.
That's great. That's
yeah,
great.
I'm the person who goes out and begs people to donate stuff.
Oh, cool.
Yeah.
I should get you to come work with MSViews too.
There you
yeah?
go.
There you go. All right, so let me stay with you for a minute. How do you control your symptoms? What have you been doing? Are you using medications?
I started on Ocrevus in May, so that actually delayed my being able to get vaccinated.
Gotcha.
So I did my 2 first doses, and now I get the next one in November.
Okay, and Pam, what about you?
I've been on Tisabri.
Okay.
I was getting it every 4 weeks, but my JC virus turned positive, so they moved it to every 6 weeks, and now I'm negative again. And it's been the best thing ever. I used to have to walk with my walker all the time. Now I can walk with a cane, and I just try to keep busy. I try to walk when I can, and just keep positive.
Okay, Michele, what about you?
I learned the value of naps during the day. I never used to be a nap person, but now I love it. So MS, one of my worst symptoms is the fatigue, and it's really, really bad, and I can't take any of the drugs to help you with that fatigue because it raises my blood pressure. So I've just found that I have to take naps and rest when I can, and that's the best that I can do. And sometimes I have to turn down plans, which make people unhappy, but I have to do it.
Yeah.
So.
How about your own family? How they handle it when you have to turn down plans? If your husband wants to go out for dinner and you have to tell him that you're too tired, how does he handle this?
Depends on the day. Sometimes he's better than others, but sometimes he really gives me a hard time, and so I give it right back to him and I say, "Look, I gotta take a nap. I gotta take a break. Maybe we can do it tomorrow instead," or
Right.
That's what we have to do sometimes.
Right.
My daughter gets upset too, and I have to remind him, sorry, I'm tired.
Okay, so I was going to not ask Howard this question because this wasn't the thing, but now I just thought of something. How do you drive your wife to do a little bit more?
Persistency.
Okay, is there anything special that you want others to know of how you can, tell her that, maybe going out would be, a good thing? Maybe you'll feel a little bit better?
One of the things that has happened over the last year, you become very comfortable at home. I joked today, we took showers to come here to do this, but you get a little more comfortable at home. So I think trying to get back into a normal routine where as if she was going out of the house helps quite a bit.
Yeah.
Just managing your day rather than rolling out of bed, going to work, sitting at your desk. But it's really difficult, as the old adage, but you look so good. So it's hard sometimes to remember that there is something going on there. And it's like, but let's just go out and just enjoy things, get out of here for a minute, especially over the last 18 months, being locked up.
Yeah, I understand that. So, you're making me, though, have to ask you. I wasn't going to bring it up, but I'm going to bring it up anyway. You said you took a shower to come here.
Yes.
Did you not take a shower yesterday?
No, I did last evening, and we were going out last evening. So
I'm glad to hear that. Okay, I'm really, really glad. Really glad. So going forward, sorry about that, but going forward, Lliki, when you found out that you were going to be using Ocrevus, did you have any concern knowing that this is going to, it's a B-cell depleter, okay, and how it might affect you with the current situation?
Okay, so I was concerned, and as a matter of fact, after I started taking it, or my 2 infusions,
Sure.
I got a UTI, TMI, and I got a nasty cold the second time. So they said, yeah, that's normal. I'm like, well, that's great. So then, yeah, I kind of feel like, all right, so forever now I have to worry about getting sick? Like, I've always been healthy.
Mm-hmm.
And so now I feel a little bit more like, well, we've got this pandemic going on, and what if I get sick? But so far, I've been good.
A lot of
Doing
people
well.
with multiple sclerosis do not get ill as much as the general population. Okay, and you're using an immunomodulator, so that's making your system to be able to have colds that you didn't have in the past. So anyway, how about the two of you? Pam first, did you have any concern with the Tysabri and the pandemic?
No, because where I'm going now, they're very, very careful about everything there. They have, for each person, it's like closed off in like a plastic shielding. And it's somebody who does a lot of your talks and everything, so I feel very comfortable there. When I first started, it was going to a cancer center, and the person there didn't think that people with MS had any problems. So a bunch of us left there and went to like different doctors' offices to get our infusions done.
Sure. Michelle, I didn't catch which medication you're using.
I'm on Mavenclad, so I was very concerned because, it's a total restart of your immune system. And I pretty much, I like to tease, like Howard kept me in lockdown. Like, I could go in the car, but I couldn't go out. Like, if he wanted to go to the grocery store, I'd get in the car just to go for a ride to do something.
Sure.
But I couldn't go in the grocery store because he didn't want me doing that. He became like so overprotective of me during that time because he was so afraid that my I would catch anything. And so he kept me, I like to say, on lockdown. He used to tell me, when I'm on lockdown, I can't go anywhere right now.
Yeah, I think I got that from him. I asked you guys to come do something else, and he said no.
Yeah, he would tell people we can't go out right now. Michelle is still, her immune system is still being repaired, I guess, if you will. And I'm actually at the point now where I've been a year past my second year, or almost a year past my second year treatment. So
Sure.
My immune system probably isn't where it's supposed to be, but it's much, much better.
So tell us about that. Tell us about the Mavenclad, and do you have to do another treatment after this second?
I don't personally have to do another treatment. They have found in the clinical trials that taking a third year, you can take one, but they found that it really doesn't do any different for people that take a third year versus the people that just took the 2 years. So,
Gotcha.
So I haven't had any issues.
Gotcha. So when do they retest, or when do they come to figure if you would need a reboot or a booster to your Mavenclad?
I will be getting probably very soon another MRI, which will show if I have any new lesions or any active disease, and then they'll make a decision from there. And also, you can, if the Mavenclad didn't work for whatever reason, you can then take another therapy if you need to. So
Gotcha.
it doesn't preclude you from taking a different
Gotcha.
one.
Pam, you had something?
Yeah. Before I got my infusion, I didn't feel comfortable going anywhere. My vaccine. I didn't feel comfortable going anywhere, and even now I always wear a mask no matter where I go. If I go somewhere, I don't eat inside anywhere. It always has to be outside. I'm supposed to be getting an MRI, and I still don't feel comfortable going to a hospital to get that done right now. I just feel like with everything going on in hospitals and being in the big tube, and I just don't feel comfortable getting that done right now.
Just so you know, the MRI centers are usually away, though, from where they have patient intake. So, with all the patients coming in that are sick going to the hospital, your MRI centers are usually far away from that. So just keep that in mind, or scout it out. All right, you could scout out where you're going to be going to, and you might feel a little bit better about that I mean, I was surprised also. I also had an MRI recently, and I totally forgot when I went to the hospital that this is in a totally different wing of the hospital, and you come in separately from the outside. You're going right into the imaging center. You have no sick people in there. They don't allow them in. So you do get tested going in the door there.
Unrelated to MS, I've had 2 MRIs this year, and I felt perfectly comfortable.
Sure.
One was in January, and the other was just 2 weeks ago for my foot. And they were at the Winter Park Hospital, and it's across the street from the hospital, actually 2 buildings away. And it was at night, and there was nobody in there but myself, the tech, and the receptionist.
That's right. That's right. So it's just something to think about, and that's why I want to let you know. By the way, camera, I forgot to tell you who I am. Here I am introducing everybody, all right? And I am Stuart Schlossman, president and founder of MS Views and News. And as you probably do know, I too have multiple sclerosis, and that's why I could share the conversation. Okay, can you share any tips with everybody or techniques on how you're getting through your days?
Well, like I said, I just got a new puppy, so that helps. But I also do a lot with Zoom calls. I'm working with a young man who's 19 years old who wasn't able to talk to anybody, and he has Asperger's, and now he's talks to me on the Zoom calls all the time, and he needed to get some lab work done, and he was afraid to get anything. So I told his father to call this company in, and they took the blood at his house for him, and So I work with different kids, different ages, and everything. I love doing that, and like I said, I started up with UCF Nursing Alumni Board again, so we're working on things for the alumni committees and things like that. So I just try to keep busy. I mean, for a while there, you get depressed at times. I have no family left, so you just I did a lot of reading, a lot of playing video, little handheld games to keep my mind going. But you just can't give up.
Good, thank you for that. And Lliki,
Yes.
how about you?
A day in the life of Lliki. I basically do Rotary stuff. I get together with friends. I have family in town, so I get together with them. I visit my parents quite often in Miami. I play bunco. I just really have a good time. I mean, not every day. There are days where I'm just like, oh my gosh, this is the longest day. I wish I had something to do.
Yeah, before you were vaccinated, or even were you seeing your parents, and if so, were you masked?
I would not wear a mask. My parents were vaccinated.
Right.
I know this is terrible, but I just don't wear a mask all the time around everyone.
Okay.
Now I do again because it's becoming kind of mandatory. And for the sake of other people, if I know their health was somewhat compromised, then of course I would.
Okay.
But if I was with other people, at the same time I'm not hugging everybody or
That's right.
like touching and that type of thing.
How did it feel
So
when you were able to hug your parents again?
I never stopped hugging them.
Okay.
And they told me not to. They were just like, if we're going to die from a hug from you, that's okay.
That's good. That's
yeah,
good.
they just really kind of felt like I'm their only child left, so
Okay.
they would rather die happy.
Okay.
Nice to know I make someone happy.
Thank you. Thank you for answering that. Michelle, how about you?
Usually during the day I'm working, or I like to play word games also to kind of keep my brain going. And then I try to do I haven't done it as much as I'd like to lately, but I've done a lot of like Zoom and online exercise and things like that, classes like that I really enjoy. So between that and trying to get some more energy to go out a little more and do a little more things, it's helping, and just trying to stay positive. So.
Great. Howard, tell us about you.
I work from home all day, every day, and when I'm not working, I'm taking care of the house. I got a big house with a lot of people, but I talk to friends on the phone every day, and none of that's really changed for me. I was working at home pre-pandemic.
Sure.
The biggest change I've had to make is I was traveling probably 1 week a month. I haven't been on an airplane since February of 2020, and it's very strange. I've been home that long, and I'm sure it's equally as frustrating for everybody in the house that it is for me.
As a caregiver, how were you able to handle 24/7 in lockdown?
Fortunately, Michelle and I have had a really good relationship. We've had our ups and downs through the years. We've been together for over 30 years. We've been married going on 27 years. I'll tell you what, right before the pandemic, we had the trip of a lifetime. We went to Greece for 17 days. We were able to see the island where her father was born. So we kind of were able to use that to carry forward. But we also have the ability to kind of spread out and do our own thing in the house. So that's something that's helpful. She's read a lot too. She's been reading a lot of books. But I think we just involuntarily understand each other's space, and sometimes we sit in a room and just quiet time. So that's, I think, how we've managed to kind of stay through this. I will tell you that over the last few months through this year, we've gotten a little more comfortable than I would like, because things seem to be getting better. We were vaccinated, and now we're starting to take a little more of a cautious stance again. I've got a work trip scheduled the end of October. We're considering canceling that personally, not just work related. She was supposed to go with me. I'm not really comfortable with that and going to a place that, is not great on a normal year. It's a great city, but, there's a lot of things going on there. It's Las Vegas. So there's a lot of concerns.
I'm sure there is. Sure there is. So just so you all know, before I get into the three of you, we have been super busy with MS Views and News through this pandemic, all right? We took on doing, we were doing a tremendous amount of programs, in-person programs. In 2019, I was on the road 162 nights, all right? And that's like totally crazy in itself. So when the situation started coming of everything shutting down, we were able to take immediately, we were already doing live streams, we were able to take what we already knew how to do and just turn it into what became a virtual program. So nobody's using the word live stream anymore. You're using the word virtual. All right, so we took these events and we went virtual. We tried going out a few times in 2020 still to do in-person programs. We were all ready to go to Roanoke and do a program in Roanoke, Virginia, and just a few days before, we were told that, well, you're from Florida and things are really bad in Florida and we don't want you here. So we had to rearrange the whole program so that way we did it from here, and our speaker, Megan Weigel from Jacksonville, came here and we did it with the LED screen behind her, okay, and the image was being shot to Roanoke on a big screen there so they could see her on the screen and be in the audience. They had the audience and they were asking the questions, after her talks to the screen as if they were talking to her in person. So it all worked out great. And, our video guy does a great job with this. All right, our video producer, Bill from Orlando Production, does an awesome job with this. And, we even in 2021, we've done a few live programs, small in size compared or in comparison to what we've done in the past, but we have been able to successfully do programs with lots of social distancing, still putting 20 to 40 people in a room and being able to do some of these programs. We were supposed to be in Jackson, Mississippi 2 weeks ago, but just before leaving for there, 2 days prior, we found out that our speaker couldn't speak, so we had to do a virtual program instead. We asked Dr. Aaron Boster to fill in and do this virtually. Okay, and he just jumps to it each time we ask, so that was a good thing as well. But we're trying to get out there and do programs. This weekend we were supposed to be in Greenville, South Carolina, but because of the Delta variant and things going crazy over there again, we found that it would be better, if we have a large virtual audience than 20 people in the room. So we're doing it virtually, and that's why we knew that we were going to be here instead this weekend, so we decided to do this program with you guys. All right, so it was a great opportunity. So going forward, let's go with who was next to answer this question. Was it Michele? Yeah, I think you're next. Okay, so can you tell us what you've done to, to do so much more or be able to handle things going forward with this pandemic?
Like I said, I think some of the stuff, keeping myself busy, trying to rest when I need it, trying to avoid some of the situations that would be uncomfortable for me, huge crowds, things like that. That's really the best that I can do during this, and
right.
Hope that it changes soon and that we can start getting back out again safely.
Right. The Mavenclad, how has that helped with your fatigue?
It's actually made me more tired, but I can't blame it on the Mavenclad.
It could be the heat.
It could be a lot of things.
Right. I mean, we've had every year in Florida, it seems to get hotter and hotter, and this has been an incredibly bad year. And what about you, Pam?
As far as what?
As far as my question. Do you have MS? Lliki, you're up.
I know.
Did you guys already
Yes,
answer that?
that's
Wow,
what I was gonna
okay.
say.
See, that was my MS problem. Okay. All right, next. Can you, what have you heard from others and share, people that, let's start with Pam on this, all right? People that from your former support group that hasn't come back to meet yet, what have you heard from other MS patients? How are they handling all of this?
I get emails from them all the time that they can't wait for us to get together again. We tried to do it like virtual, and everybody said they want to do it, but nobody showed up. So until we can find a place again where we can spread out, we're not doing anything with it. Like I said, a lot of people said they want to meet again, but when it comes right down to it, nobody want to do the Zoom calls.
Right. So what about trying to get them to go to a community center?
We're trying to find a place, but the people to get a community center and the space and everything, you have to pay for it.
Yes.
And we're not for profit. We're just we used to do it in our doctor's office, which is too small for everybody right now. So I'm trying to see if I can find another place for them.
Okay, gotcha. Lliki.
Okay, so our support group kind of fell apart even before the pandemic, so we really haven't had any support group to go to.
Have you been doing it online?
Not so much lately.
Okay. Have you been listening to the programs that we spoke to you about a year ago?
I really
I know you were on
haven't.
a few of them.
I was at first, but I feel like I'm
I guess
always
the travel
doing
is
something.
just too much.
No, no, but just I feel like I'm always doing something.
Okay. All right. Well, that's good that you're
Yeah,
always doing something.
I mean, I do stay busy.
Right. So what
For the
about
most part.
you were involved with certain patients, though. What have you heard from them?
I have a friend who has MS, and I stay in touch with her mostly by a phone.
Sure.
So mostly that's pretty much who I speak with.
Okay. It sounds like MS Views and News has to come back to this area
Yeah.
and create another program for you all, huh?
I have to tell you, I do listen to almost all of yours, and I send your links to other people. But during the summer, they had a thing called Fringe Festival here in town. And I used to go to that because everything was spaced out. They didn't have as many people in each venue. But when I was there, I had my walker. I met a lot of people that have MS that didn't know about different things. So I gave out your link to a lot of people there, and they were absolutely thrilled to find out about you.
That's good. Thank you. Thank you. Michelle, Howard, what have you heard from people that you know that you're friendly with?
I do that too. I give your information out a lot because I guess I never really had a support group, but I've almost become a support group for people. Whenever anyone I know meets someone that has MS, they're always like, can I give them your information? Can I give them your email? Can I give them your phone? I'm like, sure, of course. I've counseled so many people on MS. Sorry about that.
You breathe too hard.
I know, I'm sorry. I try to give them as much information as possible. I always give them your information because I tell them about all the programs. And then I just try, I don't pretend to know everything, but I just try to be there. I'm going on 15 years, so, I can pretty much at least just support them, even if I don't know the answer. Obviously they should get that from their doctor, but just try to support people. And it helps me and it helps them.
Yeah. So let me start with you on this one, and then I'm going to go to Howard. What drove you to wanting to be vaccinated?
I didn't
Don't
at
tell
first.
me that Howard drove you.
Well, he was part
By
of
car.
it. Yeah, he did drive me in the car also. I actually didn't want it at first. I was a little scared because I felt like they came up with it so quickly. But then my husband, who works with pharmaceutical companies, reminded me that it wasn't so quick. It's been around. They just had to tweak it a little, and that I should get it. And so he fought for me. We were one of the ones to get it, even though we weren't old enough. And I had like a letter from my neurologist, but this was back when even people with letters were having a hard time getting
That's right.
appointments. So my husband actually kept in touch with our neighbor who's a pharmacist, and when she had shots available or vaccines available, she notified us. But yeah, Howard was kind of pushing me towards it, and I'm glad he did, actually.
So let's continue with Howard now. What made you know that you could do this injection?
I know it's a touchy subject in today's world, but I trust the science. I do work in the healthcare field. I work for a specialty pharmacy. I'm not going to talk about who I work with.
Sure.
But so I work in a very relatable field. I'm with clinicians all day long. We've actually converted all of our 100% of our business to virtual. As a matter of fact, we've done things virtual that we used to fly halfway across the country for 2-3 hour meetings. So there's been a complete, paradigm shift in business in general. But as far as the vaccine goes, because I trust the science, I read, I educate myself, and I find opinions and I ask questions when I need, advice. And
Sure.
Fortunately, we were able to find our way in February of last year, so we were quite early, and very grateful for that opportunity.
Okay, thank you. Lliki, what made you to get vaccinated?
Okay, so I was not going to get vaccinated, which
Gotcha.
I know is not a very popular belief these days, but my daughter said to me, she's been saying to me, Mom, you need to get vaccinated. All my kids have been telling me that. But she said to me about less than 2 weeks ago, you really need to get vaccinated or you're not going to be able to see Winnie, which is my granddaughter.
Right.
So I was like, man, that's really like sticking it to me, Alex. So as soon as my 12-week period was up, from taking my last Ocrevus infusion, then I went the very next day and got vaccinated.
Well, that's good.
Yeah.
That's good.
So right now I have that COVID arm. I don't know if anyone's...
Yeah, trust me, I know.
So I have it. I just started getting it yesterday, and then today it's been driving me crazy. Like, if I could just scratch my arm like crazy.
Use heat.
Huh?
Heat.
Heat.
Yeah, heat. You having problems lifting your arm?
No. I have that rash that
Okay, I
people
don't
are
know
getting.
about that. I don't know
Yeah,
about
and
that.
thankfully somebody told me about it last week, shortly after I had just gotten the vaccine. It's just kind of like a big rash hive type thing around the injection site. Yeah. So, and it's very itchy.
Okay. Well,
And it
thank you for
only
that.
lasts a few days. It's not supposed to be dangerous or anything like that. So
you're getting your next vaccine soon?
well, I'm scheduled to take it 2 days before I board a plane.
Okay.
And go on vacation for a couple days. So I think what I'm going to do, and the pharmacist said it was okay, I'm going to postpone it and go the very next day when I return, because I had no issues whatsoever
Sure.
from the first vaccine. I was like, man, this is easy peasy, no problem. So I'm a little bit worried that what if I have a problem after the second vaccine and I'm away
Gotcha.
feeling miserable, so I'm just going to wait. It's
Good
just
idea.
going to be a few
Good
days.
idea. Exactly. Pam,
Yes.
your turn.
As far as what?
The question. You didn't get to you on this one yet, did I? No. That's right.
Oh, why did I get vaccinated? I'm by myself and everything. I have a cousin who is a physician up in Kentucky. In fact, right now he's in the hospital. He has COVID. He had the Moderna, but he has very bad asthma. And that's why he's in there. And he kept telling me I should get it. And I got mine back in February also. I was very nervous about getting COVID. And being by myself, there's nobody to help take care of me, so I wanted to get it. And I got back in February, and now I'm thinking about getting the booster. And when now my cousin is in the hospital, he sent me a thing, get it, you need to get it right now. So I'm thinking about getting it, like maybe hopefully tomorrow.
Well, I'm very glad that I've spoken with you all, and I see that you all have been doing something for your MS communities, speaking with others, getting involved with people from the groups, just keeping people informed, and that's a great thing. I want to ask you now each to just give me a closing, what it is that you feel that you want the MS community to know that can better them from what you know about. And I'm going to start with you, Michele.
God. Thanks, Stuart.
You're welcome.
How the MS community can better.
What can enrich a person that's affected by MS in this current time?
Oh, definitely reach out to other people, even if you have to do it online through one of the Facebook groups, because a lot of the people I've noticed with MS especially are really depressed, and some of them aren't working, and like Pam said, they may not have family close by, and it can feel, especially with the pandemic, it can feel very closed in and alone and isolated. So just definitely reach out and, you know, talk to people, let people know how you're doing, and see, you know, and then have people check in on you.
That's right. That's very good. And I'm glad you said all that, because the mental health issues are tremendous since the beginning of this pandemic, with people being isolated. And yet, there are many out there, though, that have written with me or with our organization and said, I've always been home. I have been home for years. I'm not able to move around. I can't drive. I have no family. And I've been isolated all this time. And now the rest of the world is catching up and seeing how I live. All right? So those people can actually help people to figure out what they can do during the day to keep busy. Okay, so we've gotten some of these people involved with others, especially in the rural areas, you know, to enrich their lives. Get on the phone, talk to somebody. Howard, what can you say about this, especially to caregivers?
Yeah, I would say the same thing. I mean, it's equally as important for caregivers to be either a support person or to get support, because, you know, we're not alone in this. You know, interestingly enough, I think in today's day and age, you can be by yourself, but you don't have to be alone.
That's right.
You know, as bad as social media might be to some of us in the Gen X or baby boomer world, it's equally as important. And I think it's made, especially in the last year, and you heard Pam say it at work too, for me, everything is about Zoom, online meetings, using the cameras. So people may be by themselves, but they're never alone. And I think it's really important to find support. But more importantly is to make sure you're informed and your decisions are well-founded. There are a lot of people that will tell you, I did this, or I did that, or I drank this vinegar and I'm cured. There may be exceptions to the rule, but make sure you're informed before you decide to take a leap to do something like that. Speak to your doctor. You know, utilize a resource like Views and News, because it's critically important to make sure that you know before you take that leap.
Well, thank you. Lliki, your turn. What do you want to tell people that will help to enrich them on dealing better with this virus or this pandemic?
Okay, so I would say that being shut in is an awful thing. So either if no one's reaching out to you, then you reach out to others. Because I think it's very easy to get into that frame of mind like, woe is me, and I have nothing to do, and there's no one to do anything with. And sometimes because a lot of my friends do work and family members are doing things, or not all of my family is around. I have very little family in the land. But I have to be the one that's a little bit more proactive. Sometimes I find myself saying like, well, I'm calling that person again, or I'm making plans again, or reaching out to that person again. And that's okay, because it feeds me as well. So I would just say, you know, do your best to try to stay positive and active. Join a church if you're not involved in a church, or something that's important to me. So I just started a Bible study again on Tuesday. So I mean, you have to find things to do. Sometimes you have to think out of the box, maybe, but...
When the churches were shut down, were you doing it online?
I was, and then as soon as they were open, I went right back.
Great.
Yeah.
Okay. Before I get to Pam, I want to just tell you all that I know somebody who was, you know, always, as a hobby of hers, playing Mahjong. You know, she got together with different groups of people, and her friends and others, and during the pandemic, when, you know, you couldn't see your friends anymore, you couldn't see your family, in most cases, all right, she found that she could still play Mahjong with them online, you know, or learn to even play better online by doing that. So people need to know that, you know, whatever you think that's not available for you out there, it probably has now been made available out there to do. So there's just so much, and your conversations have been great. But now I'm going to hear from Pam. You still remember my question,
yes,
right?
I remember your question, Smarty. That there's always going to be somebody out there. I've had very dark days where I didn't know what I was going to do. I was like very depressed. I have a cousin that calls me every single day on his way home from work, and he lives up north. So every day on his way home, he would call me because he knew, being by myself, not having family left, and that helped a lot. When I go for my infusion now, my nurse practitioner told me to bring my dog with me. That is going to be my support dog. So I brought him last time, and everybody there loved him.
That's
and
great.
He was absolutely, it took your mind off of everything. But yeah, you have good days, you have bad days. But like I said, you've used news. I almost watch them all the time, even if I don't know where you could hear me. I'm watching you, because a lot of times I can't get to work, right? But it's all the different topics that you have on that you could look up. Every single woman helps you. And like I said, the woman that you had the last time, she had me in hysterics laughing. When she starts out with all the different words and everything.
Oh, you're talking about the sex therapist.
Yes, but I mean, you have bad days, and you have things like that will make you laugh, and it helps. And just to like I said, I get hold of other people that have MS. They call me or send me things, and we just have a little powwow together, or doing things. Like I said at the very beginning, I didn't go anywhere. I was very careful about everything, and now I feel a little bit more careful that if I go somewhere, if I go to eat, it has to be outside. I will not go to a restaurant and eat indoors, or I get something to take home. But it's never give up. You just, like I said, you have bad days, but you cannot give up.
That's right.
Also, my temple used to bring me Friday night. They'd leave a Sabbath dinner on my door.
Very nice.
Every Friday night. They still do it.
Very good. Very good.
Matzo ball soup.
Very good.
And challah every Friday night.
All right, great. Well, I want to thank you all for coming out here. I want to thank you for everything that you just shared. And, when this goes online, it'll be great. So people will learn from it.
Can I ask you, how many years have you had MS now?
Oh, my gosh. I was diagnosed in 98, but my parents kept very detailed records from when I was a child of what was wrong with me back then. And they would test me when I was 5 and younger to see if I had gluten issues and I forgot the name of something else that actually resembles, it's one of the things that resembles MS. But yeah, so when I was a kid, I had bladder issues. When I was a kid, I had running issues. And I was terrible in school because I couldn't remember anything. So it's very, very possible, based on medical records, that I had it since I was 5. So, but I was diagnosed in 98.
And you're still on DMDs?
DMDs, yeah.
You're still on meds?
I'm still on meds. Yeah, I have to be. Otherwise, I wouldn't be able to do what I'm doing. So it's being on a disease-modifying therapy is extremely important.
Thank you.
Well, thank you for asking, because that was a good question. You should be up here interviewing everybody
Anytime,
else next time.
let me know.
We'll do it. We'll do it. We'll do it. All right. Again, thank you, everybody, for coming and for doing this again.
Thank you.
Touche.
Thank you.